Hi, this is Gary Stocker. One of the challenges you face in considering a career in medical laboratory science is the use of many job description, college degree names, and acronyms that have developed over many years. Today, I'm going to briefly explain those terms and also offer some definitions of words you regularly hear as you consider your career options, including that in the medical laboratory. Let's start with the first and maybe oldest term to describe the medical laboratory science profession, and it's med tech, also known as medical technologist. It's been around for decades, and it has generally been used to describe those people who work in hospital and other medical laboratories. The next is, what is a medical laboratory scientist? And the acronym for that is MLS, Medical Laboratory Scientist. And like the med tech or the medical technologist, this always references someone with at least a Bachelor of Science degree in medical laboratory science, or there are other ways to get there, with a BS in biology or chemistry and microbiology and additional training in medical laboratory skills. You can become a medical laboratory scientist. And then finally, on infrequent occasion, you'll hear the term referencing clinical laboratory technologist. It's the same thing as the med tech or medical technologist, the medical laboratory scientist. You'll even hear some of the college programs reference the degree as clinical laboratory technologist or clinical laboratory technology. They're all synonymous. They all use that Bachelor of Science. They all use that Bachelor of Science reference in medical laboratory science or biology or chemistry or microbiology. But often they cause confusion, but really they're the same thing. They have the same responsibilities, typically very, very similar, if not identical compensation, and identical career path and career opportunities as well. And here's where the terminology nuances become more challenging. When we talk about the degree, or the career or the job, as a medical laboratory technician, the only significant word change is the last one, technician. We're really talking about a 2-year associate's degree, typically almost always through a community college, where you can learn most of the similar skills and a smaller percentage of the overall science background and earn an associate's degree as a medical laboratory technician. You have the opportunity after that to earn enough credits to get a Bachelor of Science, but that initial terminology refers to a 2-year associate degree. There are some limitations with that degree in terms of supervisory responsibilities and management responsibilities, but in essence, it's almost all of the same skills a 4-year Bachelor of Science medical laboratory scientist possesses, just not as much depth in the science content. This last reference, the last reference to these two terms, is a generic reference, generic description, generic use of all of the trained medical laboratory professionals who work in laboratories. Both the term lab tech and lab technician can refer to anyone who works in a laboratory. In general, they're not highly regarded by those in the medical laboratory science disciplines because they don't accurately describe what they do. It is a very old reference, a very long-term reference, but nonetheless, lab tech or lab technician can do either the work of a medical laboratory scientist in reality or a medical laboratory technician. Let's now briefly look at 6 common terms that you might want to be aware of as you look at pursuing a career in the medical laboratory. And the first one is the term bench. And this refers to the work area in a medical laboratory where certain kinds of testing is done. For example, the 4 common areas of a bench are chemistry, blood bank, microbiology, and hematology. You'll hear the term internship used in the context of earning your medical laboratory science degree, either the Bachelor of Science degree or the Associate of Science degree. Typically, those programs vary in length from 6 to 12 months. You do earn college credits, and it's approximately 30 college credits, depending on the program, for completing that internship. And it's really where you learn the individual skills, how to do a blood type, how to do a cross match, how to pick colonies out of agar plates to get a positive identification on a bacteria, how to run chemistry analyzers, how to differentiate white blood cells, and many, many more skills. The internship is where all of the science that you learned in high school and college is applied to the skills necessary to be a professional medical laboratory employee. I've often noticed that the terms clinical laboratory and medical laboratory are used interchangeably. Again, another area for possible confusion. Clinical and medical are synonymous. There's a slight nuance with clinical that has to do with the clinical observation and treatment of actual patients. Medical has to do with the science itself, but essentially in the context of the laboratory, clinical laboratory and medical laboratory are the same thing. Quality assurance and quality control in the context of medical laboratories are the same thing. Also, you'll see that more as part of the internship training that you get. Both reference a laboratory's constant effort to make sure that the tests results on patients they're releasing fall within accepted limits. They both are tools, devices, and processes used in medical laboratories to make sure patient results are accurate and precise. You'll hear a lot about that as part of your training in the medical laboratory. You will regularly see the terms certified and registered medical laboratory scientist or medical laboratory technician used in both referring to job descriptions and even college degree programs. Again, for the purposes of use in medical laboratories, certified and registered simply represent a term that demonstrates that a particular medical laboratory professional has been tested for the proper skills, knowledge, and ability to do the job. In today's market, with the chronic shortage of medical laboratory talent, you'll often see the term non-registered used when describing an open position that a hospital or medical laboratory is looking to fill. This simply means that the hospital is willing to take a candidate with a strong science background, typically a Bachelor of Science in biology or chemistry or microbiology, maybe public health, and train them on a specific set or sets of medical laboratory skills. Subsequently, in many, if not most cases, those non-registered medical laboratory employees go through a training and testing process to make them eligible to sit for professional registration, just like all of the MLS and MLT employees that we've talked about previously. I trust that spending these last few minutes getting a better handle and understanding of the terminology, the job descriptions, the degrees, the acronyms, the common terms used in medical laboratories have helped you get a better handle on what a career pursuit in the medical laboratory will look like. If you would like to have a one-on-one discussion about the opportunities to work in a medical laboratory, contact me at the name listed below, and I'll be sure to follow up to set up a one-on-one discussion of the career opportunities available to you in the medical laboratory.